All right, guys, welcome back to Underground Science. And in this video, we'll be talking about DiGeorge syndrome. Okay, so let's go and get started. So, first things first, we should know what it is, right? In terms of genetics. So, DiGeorge syndrome is a 22q11.2 microdeletion. Okay, so first of all, what is that, right? So, we know our chromosomes. We have a short arm, right? We have a short arm of a chromosome and a long arm of a chromosome. So, this may be So let's draw it like that, right? So it's a little exaggerated, but we have a short arm of the chromosome and a long arm of the chromosome. So the short arm of a chromosome is called the P arm, right? Or the petite arm. So this is the P arm. The long arm of the chromosome is called the Q arm. Okay. So what 22q11.2 means is on chromosome number 22. Okay, so this is chromosome number 22. We have a deletion, okay? We have a deletion, and that deletion is on the long arm of the chromosome so it's on the long arm of chromosome 22, okay? So it's on the long arm of chromosome 22, so that's the Q arm, right? Hence 22q. And then 11.2 is a specific band, so the specific location at which the deletion is. So for this purposes of this video, right, let's say that band is right here. Now, this band contains certain genes, right? This band contains certain genes, one of those genes being TBX1. The TBX1 gene is really important for the development of your thymus, right? Your thymus gland, your parathyroid gland or glands, right? Your heart, and certain facial structures. So, of course, if there's a deletion, right, of this band, right? This 11.2 band. So we're going to label this, let's say this is the 11.2 band, right? The specific location at which a deletion is occurring. And if that deletion affects the TBX1 gene, we can expect to see abnormalities in the thymus, the parathyroid glands, the heart, and certain facial structures. Okay, so that's what the 22q11.2 deletion means when talking about DiGeorge syndrome. So of course it's gonna, and we know that this DiGeorge syndrome, right? If we do see this microdeletion, that's going to lead to the failure the failure to develop the third and fourth pharyngeal pouches. So remember, right? Remember from embryology, the third pharyngeal pouch is important for forming the inferior parathyroid glands, right? And the thymus, right? So the third pharyngeal pouch, if we just take this, is important for forming the inferior parathyroid glands and the thymus, and the fourth pharyngeal pouch, right, is important for the formation of your superior parathyroid glands. Okay. And also the deletion, this microdeletion we said affects what? The TBX1 gene, right? So if the TBX1 gene is affected, it's also going to affect, we said, your development of your facial structures and heart. So let's keep that in mind too, okay, when we talk about this syndrome. So as we said here, right, we already mentioned that the third pharyngeal pouch leads to the development of your inferior parathyroid glands and thymus, and then your fourth pharyngeal pouch leads to the development of your superior parathyroid glands. All right, so let's see what we have next. So we do have a mnemonic for this syndrome, right? It's called the Catch-22 mnemonic. All right, so we can start with that, and that's an easy way to remember the findings for um, for DiGeorge syndrome. But before we do that, right, if we can quickly talk about why these things occur, right? What effect do these findings have? So remember, what did we say? We said that DiGeorge syndrome patients right, are not able to develop a functional thymus. Either it's going to be absent or it's going to be hypoplastic, right? Smaller and less, you'll have a smaller thymus or a dysfunctional thymus, or it's going to be absent. Now, why is that bad? So remember the thymus, right? Just write that here. Remember the thymus is responsible for proper T cell development, right? Remember the T cells mature here. T cells mature here, right? So they're originally produced in the bone marrow, but they mature in the thymus. So if you can't have proper maturation of the T cells, you won't have proper functional T cells. This can lead to, and why would this happen? Because you have a hypoplastic or absent thymus. Okay. So then T cells won't be able to mature. You'll make dysfunctional T cells. This will lead to a T cell deficiency, right? Because you can't properly mature your T cells. T cells can't properly mature. That'll lead to a T cell deficiency, which can lead to an immunodeficiency. Because we know T cells are really important in fighting certain viruses and fungi. So if you can't have proper T cells, you won't be able to fight viruses and fungi, which could lead to infections, right? What else did we say that the third and fourth pharyngeal pouches develop into, right? We said the parathyroid glands. So if you don't have functional parathyroid glands, or in this case, if you have, so let's write that down first, parathyroid glands, and what the effect will be here if these don't develop properly. So if you have hypoplastic or absent parathyroid glands, because your third and fourth pharyngeal pouches can't develop properly, what do your parathyroid glands secrete? Parathyroid hormone. What does thyroid hormone do? It's responsible for increasing your blood calcium levels. If you can't secrete parathyroid hormone because you don't have functional parathyroid glands or absent parathyroid glands, then you're not going to be able to upkeep your blood calcium levels. This will lead to hypocalcemia. Okay, so you can see things like tetany and seizures with this. And remember, calcium is important for muscle contraction, right? And then remember what we said, right? In this deletion, the TBX1 gene is affected, and the TBX1 gene is important for development of the heart, for proper development of the heart and certain facial structures. So you can see certain cardiac defects also, okay? Cardiac defects also, like tetralogy of Fallot, and we'll talk about these defects when we do the cardiovascular playlist, right? Tetralogy of Fallot, and you can see things like other defects too, like truncus arteriosus, for example. But just know you can see cardiac defects. Okay. All right. And then of course we said what? TBX gene is also important for development of certain facial structures. So you can have facial abnormalities too in this DiGeorge syndrome. Okay. Now to remember all this, there's a nice mnemonic. It's called the Catch-22 mnemonic. So let's just go down and see what all these stands for. So the C in catch, right, stands for cardiac defects. Okay, cardiac defects. The A stands for abnormal facial structures, right? Abnormal development of certain facial structures, like a cleft lip or cleft palate, for example. So if we just write that down, like a cleft palate, for example, right? The T stands for thymic hypoplasia or thymus dysfunction of the thymus. So we can just write thymic hypoplasia, right? Which will lead to, we already know, a T cell deficiency. As T cells mature in your thymus, and if your thymus is not functional, then you won't have mature T cells. And the C, which we already wrote, right? So along with abnormal facial structures, right? We can actually remember this C can be devoted towards cleft palate, which we already wrote above. The H was going to be for hypocalcemia due to of course, dysfunctional parathyroid glands. So you're going to have due to our parathyroid dysfunction, right? Whether that is absent or hypoplastic, as we discussed before, right? Either way, the parathyroid glands won't be able to secrete parathyroid hormone, leading to hypocalcemia. And the 22, of course, is for to remember the genetics part, which is a 22q11.2 microdeletion. All right, so that's a nice mnemonic in order to remember DiGeorge syndrome. Okay, so let's see what we have next. So this is just a review, right? If you have thymic hypoplasia, you won't be able to have functional T cells, so you'll have decreased T cells, right? Because that's where your T cells mature. And if you have decreased T cells, we know that puts you at an increased risk of fungal infections like Candida and viral infections, some examples being Epstein-Barr virus and cytomegalovirus. Okay, so that's important to know for thymic hypoplasia and what that can lead to. Another thing we should know, or we should keep in mind, as we discussed before, is hypoparathyroidism. Why? Because your third and fourth pharyngeal pouches are responsible for developing into your parathyroid glands, right? Your inferior and superior parathyroid glands. If you can't develop your parathyroid glands, you're going to have low blood calcium. Okay. And that's bad because, for example, your muscles need calcium to function properly, your nerves need calcium to function properly. So you can see things like tetany and seizures. Another high yield thing we should know is remember parathyroid gland, right? So if you remember this, parathyroid gland can go to your kidneys and help your kidneys activate vitamin D, right? Which can, of course, increase calcium reabsorption from your gut, vitamin D. Okay. But if you don't have parathyroid hormone, you can't do this. So that can contribute to low blood calcium levels. And also, remember when your parathyroid gland goes to your kidneys, right? Especially in your distal convoluted tubule, for example, parathyroid gland increases reabsorption of calcium. Okay, remember that parathyroid hormone goes to your distal convoluted tubule of your kidneys and increases reabsorption of calcium. But at the same time, it also increases excretion, okay, of phosphates. Now, the reason why parathyroid hormone does this is remember, parathyroid hormone is trying to increase your blood calcium level. But remember, phosphates bind calcium, which decrease calcium level. So your parathyroid hormone does not want that. So when it goes to your kidneys, it reabsorbs calcium, but it excretes phosphates in your urine, right? If you have hypoparathyroidism due to dysfunctional parathyroid glands or absent parathyroid glands, you don't have PTH secretion. Now remember, usually PTH increases excretion of phosphate in your kidneys, as we just mentioned. But if you can't do that due to no PTH, then you're going to have increased blood phosphate levels, that which will also further contribute to decreased blood calcium levels, because remember, phosphate binds calcium, decreasing calcium levels in the blood. If you have a lot of phosphate in your blood, right, because you don't have PTH secretion, so you can't excrete phosphate in your kidneys can't excrete phosphate into your urine, that's called hyperphosphatemia, right? And as we just mentioned, if you have a lot of phosphates that can bind calcium in your blood, which will reduce free blood calcium, okay? And of course, that's called hypocalcemia. And that, as you mentioned, the previous slide also, hypocalcemia can cause tetany and seizures. Why? Because remember, calcium is important for overall function of your nerves and muscles. Low calcium will actually decrease the threshold for depolarization. So that way, things like nerves, for example, may fire quicker, right? Because you decrease the threshold needed to depolarize. Remember, in an action potential, right? You have a threshold potential, and what happens is if when sodium's rushing in and things like that, right? We gain positivity, right? You gain positive charge inside your neuron, and as you keep on gaining positivity, right? You hit threshold potential, which then from here you get that action potential, the depolarization, repolarization, and so on, and the hyperpolarization, right? What Low calcium does is actually decreases the threshold potential so that you only need to hit positivity until this mark before an action potential hits. Okay, so that's why it can increase your risk of increase frequency of seizures, right? You increase your risk of seizures and increase and induce tetany, which is basically contraction of your muscles. So basically things like spasms or cramps or twitching and things like that. Okay, so like involuntary muscle contractions, basically involuntary muscle contractions. Okay, and seizures because you decrease the threshold of depolarization. So this nerve, right? Let's say this is an action potential of a nerve, it can depolarize quicker, right? It doesn't have to, you don't have to gain positivity until this threshold, right? The threshold actually decreases due to low calcium levels. So you only have to gain positivity until you hit this mark right here in order to hit that action potential, in order to get that action potential, which is why low calcium levels can increase your risk of seizures. Okay, so that's that for hypocalcemia and hypoparathyroidism. Okay, so let's go ahead and see what we have next. So next is, of course, treatment, right? But before we talk about the treatment, I want to talk about a few more things that you can see with hypocalcemia. So if we just talk about hypocalcemia for a little bit, talk about this more when we talk about calcium and electrolytes and all that. But with hypocalcemia, you can see other signs, okay? For example, well, like we already talked about, you can see muscle cramps, right? You can see muscle cramps and tetany, things like that, involuntary muscle contractions. You can also see carpal spasms, right? Carpal spasms, which is the Trousseau's sign. All right, so this is the Trousseau's sign. And like, for example, if you inflate the blood pressure cuff on a patient higher than their systolic blood pressure, then you can see the severe carpal spasms. Okay, that's going to be the Trousseau sign. And then, of course, you can also see facial twitching too. Okay, facial twitching, which is another sign that we should be familiar with. This is also called the Schwostek sign. All right. So if you tap on the facial muscles, right, you may see facial twitching, which is called the Schwostek sign. And that can be due to hypocalcemia also. All right. So, and then another thing that could indicate hypocalcemia, along with other things, of course, but it's also seen in hypocalcemia, right, is perioral tingling. So that's something that you may see. So perioral tingling, we'll just write it right here. Perioral tingling, especially if you see something like a patient has carpal spasms, muscle cramps, the whole Schwostek sign and everything, and perioral tingling after they undergo thyroid surgery or parathyroid surgery, right? That could indicate hypocalcemia. Okay. So that's basically what I wanted to talk about for hypocalcemia. Now we can move on to treatment. Okay, so remember, if your thymus is hypoplastic or absent, you don't have functioning T cells. If you don't have functioning T cells, you're at increased risk for fungal and viral infections, even certain bacterial infections. So, of course, you would give antivirals, could be a choice, right? Or antifungals or antibiotics, which makes sense, right? If your parathyroid glands are hypoplastic or absent, you can't secrete PTH. If you can't secrete PTH, we know that that'll lead to less vitamin D activation in your kidneys, which will mean less blood calcium levels. Less PTH means less excretion of phosphate in your kidneys, which means hyperphosphatemia, increased phosphate levels in your blood, which means more phosphate can bind calcium, leading to hypocalcemia. So, of course, we try to increase calcium levels via calcium supplementation and vitamin D. And then, of course, we said the TBX1 gene is important for development of the heart and certain facial structures. So you can see things like low set ears and cleft palate and congenital defects relating to the heart, like truncus arteriosus and tetralogy of Fallot. So to treat that, cardiac surgery can be an option. Okay. So that's basically for DiGeorge syndrome. I hope this video wasn't too confusing. I hope this video helped a little bit, and see you guys in my future videos.